Hi everyone, this is Praveen here. Today I am going to would like to clear some of the doubts regarding the H. pylori. Many people have kept on asking about the positivity of the RUT. See, this is the H. pylori detection kit. Okay. So what are the instructions given? So what is the RUT? Rapid urease test is an indirect test to know the presence of H. pylori in the given sample. H. pylori based on the presence of urease on the gastric mucosa. See, if the urease is there, that is the indirect method to know the presence of H. pylori in the gastric mucosa, and it has the advantage of over the serological examination because it detects the presence of an active infection. In the serology, what happens means on the blood test and all. So any previous H. pylori infection also, if the antibodies, we have antibodies in our body for the H. pylori, it shows that is the presence of antibodies for the H. pylori. So we will not be able to know whether this is a existing disease or a previous infection. So, but in this case, we can know whether the disease is active or not by knowing the presence of urease in the sample. It has the sensitivity of approximately 80 to 100% and specificity of 97 to 99%. See, biopsy size approximately 2 to 3 mm biopsy size is required, and preparation of the RUT. So, we will skip this area. So, procedure, we have to take the specimen from the endoscopy, and the size, recommended size is 2 to 3 mm, and then 1 to 2 drops of sterile water has to be provided on the has to be placed on the kit, and then the biopsy has to be placed over that chamber and gently close it and watch for the change of color. The main question here is that duration means if the test will show the positive result in 10 to 180 minutes, means 10 minutes to 3 hours. See, I feel the yellow color turn pink or red within 10 minutes to 180 minutes is said to be positive. If it turn positive within 10 minutes, it's a strong positive. Within an hour, is you can say is a moderately positive, and if it turns red within 3 hours, then we can say is a weak positive. Based on the colony count, how thick the organisms has grown in the gastric mucosa, based on that this positivity comes, and make sure that the patient has not received any PPI, proton pump inhibitor and antacids in the last 5 days, because that will affect on the result. So most of the people they ask this question, means their kit has turned positive after 24 hours, whether it's a positive or not. Anything more than 3 hours, the reading supposed not to be taken. See, the positive result after 24 hours are most often false positive and should not be used for the treatment decision. The test may turn positive from the presence of non-H. pylori urease containing organisms. So, it has turned positive because of the non-H. pylori organism which are containing the, means releasing the urease. So, this is all about the H. pylori detection kit. If you still have any doubts in this regard, then you can post on the chat box. Thanks for watching the video.